Hello, this is Dr. Castanet again. This time I'm going to show you a lumbar MRI scan of a lady. It's probably about 75 years old, and she has chronic low back pain. No particular sciatica at this time, but pain diffusely in both sides of her low back and her buttocks regions. This is a recent MRI scan she's had. If you look at this, you can see there's collapse here of the L23 disc. It's almost non-existent now. This is the L34 disc. It's also quite compressed and collapsed, but not as much bone on bone here. You notice the large area of edema of the bone on this T2 weighted image as a result of the pressure on the bone and the lack of normal diffusion across the disc, which is not functioning much like a disc anymore. You don't see the same modic changes or edema of the end plates of these vertebrae, but you do see a little bit of it here and modestly here. If we look at the next level, the L45 disc is also collapsed. More edema noted in the bony end plates of these vertebrae as well. This disc looks relatively good. There's still some collapse there and loss of height. And there's a small herniation there, not of much consequence. And then if we go above the L23 disc, we see, again, disc collapse. This invagination into the bone is actually a herniated disc up into the bone. We think these don't result in a lot of pain over time either. And there's a little bit of invagination, or Schmorl's node as we call them, in this vertebral end plate as well. If you look back at the neural canal here, you can see it's pretty broad here. Spinal cord ends right about here, in this area here. Let's see. This is L5. That's the top of the sacrum, so that's L5, 4, 3, 2, 1. Spinal cord typically ends at the bottom of about L1, somewhere behind L1. Above that, you see the canal is fairly wide. This looks narrow in this area, but that's because this scoliosis is showing some bony anatomy there, some of the pedicle, which makes the neural canal look like it's not patent and open at that level. But you see it's pretty widely open here, throughout here. Down here we get into some enlargement of this ligamentous tissue that makes the canal beginning to be more narrow here. There's enlargement of the ligament here, as well as the joints back here. These combine to make the canal pretty narrow at this level here, a little wider there, and narrow at the successive disc levels throughout here. So she's narrow or stenotic throughout the lumbar spine generally. This is just one sagittal image, so we'll look at other images, but you get the idea what's going on here. She's just compressed at multiple levels. We call this spondylosis with all the degenerative changes. She gets relief from spinal decompression. It's not going to open this up significantly, probably not in any visually appreciable way, but symptomatically it makes her feel better. And she's not a good surgical candidate. She does reasonably well in terms of the pain with non-surgical treatment, and doing anything about the spine that looks like this at several levels is probably a dicey proposition, both in terms of surgical risk as well as what you'd have to do to change all of this to give her relief. And since she's not having a whole lot of pain, and she can manage it fine non-surgically with spinal decompression, that's all that any surgeon is likely to recommend. I'm going to go to the next slice. Again, similar image. This is a T1 weighted image, so all the space back here is dark now instead of light. But you see the same features throughout the lumbar spine, with disc collapse especially severe at the L23 level. Let's go back to the next image, another slice. This is neither T1 or T2. I think these are called stir images. You see the edema now is dark in color at the L23 level, and the disc collapse is a thin white line there. You still see the neural canal is white in color and narrowed throughout here, in particular at the L23 and L34 levels. Let's go to the next slice. This is a cross-sectional image. We see that all this tissue in here, which should be very dark in color, like this here and here, is instead infiltrated with white fatty tissue. So there's chronic atrophy of these muscles here and these muscles here. You see this commonly in people with chronic low back pain. When the spine is collapsed and doesn't move much, there's not much use of the muscles atrophy as a result. You get this appearance of fatty infiltration throughout the muscles. It's all part of the part and parcel of this degenerative process. She has joints that are enlarged here and ligaments that are enlarged here and on this side as well. The white space that we saw in the other sagittal images is now very small in here. It's very narrow. These little dots right in here are the nerve roots. It's easy to get them pinched throughout here. As this space gets smaller and smaller or more stenotic. This should all be white in color here. But that's again another feature of the problem. That's all I have to show you on this particular patient. She has done well over the course of about the last year with just occasional treatment for this problem. It's a fine way to manage it. She does better with this than other means of treatment, such as exercises, which aren't going to do anything to ameliorate this overall collapse of her spine. And while spinal decompression isn't going to make this look much different, it provides the most meaningful redress for this collapsing spine and enough to make her feel reasonably good. My name is Dr. Castanet. I'm in Decatur, Georgia. If I can help you with your problem, my number is 404-558-4015. You can go to my website to see more of these sorts of videos on my blog, or you can go to my YouTube channel from the website. The website address is backstrong.net. Again, the number 404-558-4015. Until next time, thanks very much. Bye-bye.